The decision to have a hysterectomy isn't one to be taken lightly. It's major surgery with major recovery time.
But there is a new alternative that's making the surgery safer. Dr. Richardson from Frye Regional Medical Center joins us now to explain. We've been talking about this. We're so excited to have you here because none of us in the studio had ever heard of it.
Yeah, we've always been able to go in hysteroscopically, which means through the cervix, no incisions, just do a little dilation, and remove fibroids. I mean, the technology's been around for a long time, but the problem was, as you cut them out, you really had a hard time getting them out. And so what this newer device does, it's much smaller, first off, and it goes in, and on the end of it has a little tip that just rotates really fast and essentially shaves it off and sucks it out. I did a case last week where we had a little fibroid inside the uterus, about as big as my thumb. It took me 32 seconds. 4 years ago, I took one off like this. It was 2.5 hours.
Really?
Wow.
I mean, literally, we got it off in about 32 seconds, but then having to cut it up into little pieces through a very small instrument was very difficult. It's a game changer for being able to remove internal fibroids.
How have we never heard of this before? Okay, so what else does the TRUCLEAR procedure treat? That's one thing you can do.
Or polyps, which is the growth from the inside. I mean, I don't have a prop, but if you imagine my hand as being your uterus, my ring as being a fibroid or a polyp, fibroids can be in the center aspect of the uterus. They can be on the outer aspect. That doesn't cause bleeding. That can cause pain and discomfort, and we can't get those from this procedure. Or they can be on the inside of the uterus, so when you look in, you see something hanging in there. And so we can go in there and shave that all the way off, or a fibroid all the way off. The typical reason for causing stress, as you guys opened up the show talking about, bleeding all the time is going to create great stress. And so we can go in there and take care of this, particularly for someone who's planning on having a baby. And so you can go in and do this, because that can also lead to a greater risk of miscarriage, so you get rid of this option, and it makes it so their bleeding's better, and the inside line of the uterus is now back to being normal to be able to support that.
So how can this be an alternative for women who might think they need a hysterectomy, a traditional hysterectomy?
You know, a hysterectomy is definitive. So if you're having really bad bleeding problems, you can do the definitive aspect. As the economy's gotten worse and we can't take 6-8 weeks off from work, when you can do this and be back to work in a week typically. Some people 2 or 3 days. Well, most people I'm doing this on a Friday are back to work on Monday.
That's amazing.
So the recovery is so much easier.
The recovery is so much better, and it works.
What are some of the other benefits of TRUCLEAR over a traditional hysterectomy? Is that the big one?
The big one is the fact, and you have no incisions. I mean, there's nothing. I mean, you know, we can do everything now. We do almost everything now minimally invasively. You know, everything minimally invasively be considered through laparoscopic or from below without making any incisions. And this time, we just dilate the cervix up a little bit and go in, so there's 0 incisions. There's nothing to recover from that aspect. The only thing you're doing is shaving off the polyp or the fibroid, and then the uterus itself contracts down, and that stops the bleeding.
What's so astounding is that a woman who had a fibroid procedure 5-6 years ago can now have something completely different.
Yes.
And
10 years ago, we made an incision like this, you know, to go in and do it. We rarely do that now, even for an external fibroid. But, you know, most of those can be taken care of laparoscopically.
For you as a doctor, this must be very exciting.
It is. I mean, it's, you know, it really is a game changer in what you can offer people. I mean, like I said, we've always been able to go and do it, but to offer somebody something that's going to take 3 hours to remove something that small is very difficult to offer. So you've got greater risk for anesthesia being under that longer time and everything else. You can go in and do a procedure that used to take 2 or 3 hours, now takes 20 minutes. I mean, you have less pain, it's quicker, it's easier, as a patient's downtime is not as bad. Risk of infections, all the risks are much less.
Now we're going to need you to work on that whole childbirth pain thing. That's next on your agenda.
We have anesthesia for that. That's what the spinals and epidurals are for. There's no reason not to.
Those are wonderful things. Those are wonderful things. Dr. Richardson, thank you very much.
You're very welcome.
TRUCLEAR. I appreciate you stopping by and talking about this today.
Thank you very much.
Thanks so much.